This month's episode of Mid-Month Meeting of the Minds features Dr. Marlon Tingzon. Hi, everybody. Welcome to this month's Mid-Month Meeting of the Minds. Guess who I have here today? I have Dr. Marlon Tingzon. He's an occupational medicine physician in California, and he is one of the co-founders of MoziCare, which I consider to be a B2B platform, a physician to physician platform. And I'm going to let you hear all about it from Dr. Tingzon because he can explain it so much better than me. And I want you to hear how we met and what he can do for you because what he has is an amazing product design. It's an amazing platform. Take it away.
Yep. Thank you so much, Dr. Shaw, for the introduction. First, before I talk more about Mosey Care, let me say a little bit about who I am. My name is Dr. Marlon Tingzon, board certified in occupational medicine and aerospace medicine. So, and I'm a physician, but also a mentor who's very passionate about connecting people and helping people navigate their career and life paths. And so we're doing that through our new platform called Mosey Care, where we're essentially doing that. And I will absolutely get into more details later on in this conversation. Um, but also, how did I meet you, Dr. Shaw? Well, we've met since we have a strong shared passion for mentoring. At the end of the day, there's a big world out there, and no one can navigate it alone. And so I think you and I have that big intersection of, hey, how do we do that? How do we scale that? And so, what defines me, and I think this professional relationship is connection, whether that's with our patients, our colleagues, our mentees. And I really want to lead with empathy, humility, and curiosity. And so that's what MoziCare is. That's what we're doing. As we're building our platform. We want to really break down those barriers for people who see, hey, how do you get into that role? How didn't know that role exists? We want to connect those people, close those gaps. So I'll pause there.
I love it. You're right. Even though I don't see patients anymore in my role as a physician coach and founder of PlansConnect, I am still helping people and I'm helping physicians be the physician they want to be. And I'm tapping into my natural skills and helping them realize their natural skills. And I love that MoziCare is is like the modern day platform that we have for helping physicians help each other. I'm
Yes.
going to let you
Yeah,
say more
yeah.
about that because I think it's impressive. We're still curious to learn about the world. And I think when you said that word, that really resonated with me because it's the curiosity. That was a highlight of my very first podcast that I did. It was an engineer and myself, and we took the time to learn about what each other is doing. So,
Yep. Yeah, well, on that same note of world and globe, I didn't really mention what I'm doing now. You mentioned you're no longer seeing patients. I know you saw OB-GYN patients for many, many decades.
yeah.
A little bit more about my background. I spent most of my time in the U.S. military, which was wonderful, practicing medicine all over the world on ships and on in foreign
Wow.
lands. Yeah, it was great. It was a beautiful 9 years of that. During that journey, during COVID, I shifted my focus from one-on-one patient care to population health, to doing scalable policies as a physician, using my background as a physician to treat more than just one person, which is obviously very highlighted in during COVID-19. That's one reason I did a big pivot into occupational medicine because I was very passionate about people's work environments. People work most of their lives, so if you're healthy in that setting, you'll be healthy for life. Um, so it was during that time where it was very formative for me to shift from let's say the patient room to a podium, getting in front of people, talking risk communication. Hey, this is why you need to get a vaccine if that's the flu vaccine, COVID vaccine. This is why you need to get tested, why you need to wear a mask, for whatever the condition might be. So since the military, I've been doing different corporate roles. I was at a company called Henkel for a year as a regional health director. And again, speaking of globe, I'm currently serve as the global lead for occupational occupational health at the Google data centers. So I'm in a position right now in tech where I can really scale different health programming to help people. And yeah, I like to share, how I got here. Um,
Well, let me pause you for a
yeah,
second
yeah,
because population health is actually one of the hot topics in healthcare now. We don't really talk about it. It's sort of like public health, it's behind the scenes, but population health, interestingly enough, I just had my 30-year med school reunion and it was at Jefferson, and one of the leaders for population health is there, David Nasca or Nash. I forget how to say his name, but I'm going to forward this video to him when we
sure,
finish it, because I
absolutely.
know that population health is so important. I mean, I'm a fan of public health, but public health for the masses. So that in turn is population health. So keep going.
Exactly.
I didn't mean to interrupt you, but I wanted everyone to know how important this topic is. It relates to the world as we know it today, and it's changing. How the world is changing is impacted by population health.
Exactly. And population health in itself is a huge topic. You can kind of equate it to like, epidemiology and some like real hard studies of, hey, people in the inner city, or if you live closer to a freeway, you'll have higher asthma rates. And how can that inform policy on a government level? Um, but where I do it in the tech sector, I'm doing it. I'm scaling programs for within the data center environment. We have, thousands and thousands of employees. And so how do I ensure policies protect them? And so that's what I do in my programs without getting into too much of the details. So yes, population is extremely important. And also, again, we're physicians, right? We're smart. We know the pathways, pathophysiological pathways, but how do you convince somebody who has no idea about that? How do you talk to the senior leaders? So that's a big part of it. Um, and let me say a little bit more about just, passion of why I do this, population health or friendship mentorship. I've really believed every physician, every professional, regardless of years of experience, and Dr. Swati, you've been doing it for decades. Everybody has something to learn from each other, no matter where you are in your path. I see all docs as peers, and my why is just opening minds to those possibilities. The moment someone realizes, like, hey, you're doing that, can I do that too? And yes. How do you get there? That's a big part of it. So let me pause there before I keep going. If you have anything else, Dr. Shaw.
No, no, so true. We all have something to learn from each other. This is a lifelong learning path. That's all I can say. I never dreamt I would. Well, it just never occurred to me. By the time I finished my clinical years, I had used 10 different EMRs. And then now I probably learned another 10 pieces of software. I taught myself Canva in the past year and so many other things. And you just keep going. There's nothing other than
Exactly.
it's lifelong learning.
Exactly, exactly. I don't believe in the phrase, you can't teach, a dog or, an old dog new tricks.
Right.
We can always learn something. And again, like, we're doctors, we're go-getters, we have that grit. But, we can apply that to other places. So, kind of pivoting back to the mentorship piece of it, things that I like to offer my peers, in any setting, is networking and guidance and validation. A lot of folks, they don't know what's out there, but also they don't need someone to tell them what to do. They just need a sounding board, who might understand your journey, someone who can help them connect the dots, see things that they haven't considered. So one thing I really am passionate about is just slowing down. Hey, let's reflect. What are some tangible steps to get to where you want to go? A new career direction, leadership growth, or just rediscovering balance. Simply a lot of people simply don't know what occupational health is. One of the specialties with the least amount of burnout. We're not on call like the OB-GYN doctors are waiting to deliver a baby. A lot of work-life balance simply going into occupational health. But in even more so, like, there's corporate roles that I am in, where there's a lot more work-life balance, but also doing something cool and scalable and very important. Um, One common issue I see is that it is burnout or loss of direction. I can't count how many docs I know, smart folks, they might have went to one of the high, prestige schools, very research focused. So they finish med school, they become an attending at the med center. They do research, they join all the committees. And that's great. They're on their way to full professorship, but they just don't know what else is out there. Not by their own fault. They just, their network is limited to where they are. And so, yeah, that's like can be autopilot. You're checking boxes, you're checking titles, but some folks don't feel
True.
fulfilled by that.
Very
And so,
true.
hey, what do I really want is a big question. We would just talk through. So pause there for a second.
No, no, that's so true. And it's actually interesting. I hope whoever's listening to our podcast realizes that this is truly organic because as I'm listening to you, I'm feeling invigorated and I'm feeling realigned with what I provide as Plans Connect. I actually have a coaching package where we spend the first hour discussing what are your natural skills? What are your natural talents? What gives you passion? What do you want to get out of bed for? Okay, now then the next hour we put it into your LinkedIn profile. We identify what's transferable. I can't tell you what that job will be, and I don't know where that job will be, literally in the universe, but I can position you, show you how to position yourself. I'll give you the tools that you can build your career with so that you can get what you want out of it and you can feel satisfied, right? Because no job feels like work if you're doing something you love.
Exactly. I mean, and on that note of, how do you get there, quote unquote there, that could be kind of an elephant in the room. Again, we're all successful in our own right, but there's some positions out there you might just be like, that is such a cool role. Like, how did you get there? And I will say, like I said, there's so many nuances and variables. It's hard to say like, this is the role you're going to get, and I'm gonna make sure you are the sports team doctor. It's not exactly like that, but
No,
you
no,
know,
it's not. It's not a
yeah,
linear path. Like whenever
yeah.
anybody asks me, how did you start your own business? How did you decide to leave clinical medicine? Or it wasn't an A to B straight line. Oh my goodness. It's more like A, B, C, D, E, F, G. It's not even a graph. It's not even a
Exactly.
seismic any wave or anything. It's just it is a path, but it's
Yep.
a winding circuitous path. And it's like our meeting today. It's fortunate that we met. It's serendipitous. We took advantage, and now we're talking more. I am dying to hear the more about MoziCare, which is
Yes.
your creation. Can you elaborate, please? If
Yes.
I didn't steal your thunder already, sorry.
No, no. I mean, I got a response that you use wonderful. You use the word serendipity. Um, you know, People doing what they're doing, is it luck? Is it hard work, networking, serendipity? My truth is, I think it's all of the above. And
Exactly.
but we can. There are some tangible things that you can do, but definitely investing in your personal why, and what matters to you the most. So, but yes, MoziCare, again, we are a platform that is made to connect physicians to physicians. Creating mentorships so that you can get to that next step. A lot of our people on our platform so far have done some amazing things from lots of different companies. I'll let you look where those people are, but they didn't get there. I mean, they got there through hard work, determination. There is some timing, of course, but there is some grit in there. There is like the way you network, how you're presented, and whatever platform that is, like LinkedIn, to really push you to where that is. And so we are growing our platform. We saw a big gap in just how do people get those mentors. I know there's like there are many websites where, hey, like you're already a part of the American College of Health Executives, or you're part of whatever American college of whichever specialty, and they might have mentorship program. But we wanted to connect people, eliminate some of those steps and just get you to somebody in a role that you might want to be in, and just connect you right away. And we're big on like mentorship, not necessarily coaching, but hey, that mentor to be a sounding board, to be someone to bounce off your ideas. and help you build that why. So that's our purpose of MoziCare. Founded by three docs who knew each other through our networking through the American College of Occupational Medicine, and even with with our friends from medical school, we're always just like, hey, how are you doing? And they reach out back to us like, that's so cool that you're doing that now, and I want to share it. But it's come to a point we need to systematically share this with the rest of the world, and so that's what we aim to accomplish is connecting folks in a mentor-mentee relationship and breaking down those barriers to make it easier.
Now, I love this idea of physician mentor, physician mentee. And however, I think we should be clear or transparent that your service right now, you're in a startup phase. And so you're not charging physicians who wish to be mentors to be on your platform. However, those physicians are not necessarily offering their mentor services for free. So I know no one likes to talk about money, but it does cost money to run a platform. And you three worked hard to build this. Like I said, it's a B2B platform, not business to business, but physician to physician platform designed to serve, as you described, mentor to mentee. Um, can you talk a little bit more about the financial operation of this venture?
Yes,
Not in detail, but just a little bit so whoever's listening will understand more.
yep. Keep it to the treetops. So you can sign up as a mentor. You simply set your own rate by the hour, but you could do half-hour meetings with people, and you set your own availability. And so at that point, you get listed on there. We have an option if you wanted to do like a free, 15 or even a 30-minute consult with somebody, so that they know what they're getting into. They can set some expectations before they put down the money, because a lot of our mentors, they're not just any docs. These folks have been in some very prestigious roles, and so there's a lot to learn from each other. I will go back to saying, like, everybody is a peer in my eyes. You have that MD, but at the same time, like I said, systematically, it gets challenging to be able to provide that service to everybody, and so to make it worth everybody's time, that's what we're doing. And so, like Dr. Shah just said, right now we're not. Our business model is you set your own rate. There's a very small fee that basically the credit card company takes, but we as a platform are not taking anything off the top as this time is we're in our growth phase. So that's how
Wow,
we're doing it right
very
now.
impressive.
Yeah.
Very, very, very impressive. So, um, what do you think we should tell our listeners? I mean, how should they follow you? How should they stay in touch? Is Mosey Care only for physicians, or what other platforms do you recommend if they are other healthcare professionals?
Got it. Right now, MoziCare is focused on physicians to physicians. However, we don't exclude people. If you're a medical student aspiring to be a physician, or even pre-med, that is an avenue people could take. I will plug Mozy Box right now. It's a sister company where we're off. That is more salary insights and also lots of different roles that people feel like they can't easily find, like non-clinical roles, or hey, you might be interested in a role in AI. We have lots of opportunities there using AI and machine learning to really cater your results to you. But to get more to your question, if you are just a general health professional, let's say you are a chiropractor or an acupuncturist, you could utilize MoziCare also. But right now we're keeping it a limited focus as we grow. Um,
That sounds fantastic. I'm gonna okay. Um, Marlon, this has been sorry, forgive me, Dr. Tingzon. I am very, very laid back and I apologize. Um, I want to tell our listeners how should they stay in touch with whichever aspect they're interested in, Mosey Care or Mosey Box, and why should they pick one? Like, what are the best ways to stay in touch? Is it a website, LinkedIn? What is it? So I'll put it in our caption, but please let our listeners know.
Yeah, no, th thank you, Dr. Shaw. And yep, as mentioned, Mosey Box is more of the job opportunity and salary insight branch of the Mosey brand, and Mosey Care is the mentor-mentee connection mentorship branch of our companies. So personally, you can reach out to me on LinkedIn. You can find my name. My name is unique enough where you won't find another Marlon Tingzon. But you could also, go on Mosey Box or Mosey Care and contact me through there. It goes to the founders, and we can connect that way. Or you can go ahead and book a session with me, consultation, or we can just start getting to business. And so, yep, love hearing people's stories, seeing where their paths take them, and will take them. So that's where to find me.
That is great. Yes, and I'm proud to report that I'm also listed as a mentor on the MoziCare website. So that's another way to find me. But I'm really happy to be on there with you, and I thank you for that opportunity. Um, I'm also thankful that you spoke so eloquently about what you're doing and your passion. I mean, it's your why. That's what makes you good at what you do. If you do what you're passionate about, you should succeed. I mean, if you're passionate about certain addictions, that might not be successful, but
Yeah.
professionally speaking, so what would you say is a call to action for our listeners? What should they do if we have physicians listening or other healthcare professionals listening? What should they do next?
Yes, great question, Dr. Shaw. And maybe this is a hot take, but my advice, as a call to action is, hey, maybe take a step back. I'm sure everybody's busy. Hey, you might be operating, you might be doing a fit test on somebody. Um, take a step back, slow down, maybe even digitally detox for a bit. That's something I'm struggling, with my kids and trying to work while, preparing dinner. But reflect on your dreams, your priorities. Ask yourself, what's your personal why? Thank you, Dr. Shaw, for pointing out, my why for mentorship. Is it family, work-life balance, purpose, and whatever it is. I want you to let that guide your next step. Networking, mentoring, community. It's all mean nothing unless they move you closer to what really matters to you. So that's my advice,
I
to
love
slow
it.
down and think about it.
In 2011, I signed up for a career coaching session at the American Public Health Association's national meeting. And I paid $45, which at the time I felt like was a lot of money. And um, the coach that I picked was a psychologist who specialized in maternal child health careers, which is what my passion and my background was with between obstetrics and gynecology and public health. And you know what she told me to do?
Mm.
She told me to take a vacation. And I walked away so frustrated, like, I paid $45 to be told take a vacation. But now it's 2025, and it's so true. You have to step back and really detox, decleanse, whatever cleanse, decluttered. I don't know what the phrase
Yep.
is, but you
Yep.
have to clear your mind to really find out who you are. And sometimes you have forgotten who you are.
Yep.
So whether it's a detox from devices or I love to sit on my porch, take a walk. Taking a walk clears my head. It's how I made it through the pandemic. Nightly walks, and doesn't even matter if it's 10 minutes, 30 minutes, 40 minutes, just walk somewhere.
Yep. I love it. No, great advice. My wife and I, we do that too. After our kids are asleep, we do that an evening walk to clear our heads and to to continue getting to know each other. But yeah, on that note, I guess, I have one, final thought was, um Well, the power of networking, of course, that's obvious. But wherever you get that, if that's through MoziCare or you're going to your annual conference, whatever that might be, it's those hallway conversations that hold a lot more value to me, versus, hey, these are the new JNC 8 hypertension guidelines. They're important, but also it's, hey, when you are at the in the line for the buffet, those are some of the more important conversations. So all that said, I think, let's continue the conversation. This is not a monologue, not a one-way road. And, sharing those real examples of how mentoring and networking opened unexpected doors, how a simple conversation can shift a whole perspective. Those are the parts in life that really have shaped me. And, putting yourself out there, sometimes you gotta do it yourself and use services or and if we can walk away being inspired by a mentor, reconnecting with a colleague, we've already made it a win-win, whether you use MoziCare or not.
I love it. You've inspired me today. And thank you for introducing the world to MoziBox and MoziCare. MoziCare is your big thing that you helped found, and I love it. So happy to be a part of it. Happy to have you here today. And I look forward to future conversations. I'm going to have to plan a trip to San Francisco just to come and hang
Yes.
out with you guys. So, because all three of the
Yes.
founders of MoziBox and MoziCare are in San Francisco, and it's one
Yep.
of my favorite cities. So,
Yeah. Thank you, Dr. Shah. I really appreciate your time. Thank you.
thank you.